I'm here again today with Bonny Specker, epidemiologist, who is going to talk to us about what's been going on with COVID across our state, in our region, across the world, and in our nation. But also today, she's going to talk to us about some new things with the CDC, some projections for South Dakota and Brookings County. Also talk about vaccine misinformation, the new Omicron variants, and once again, our global and national and local situations. So Bonny, tell me all about what the CDC has launched.
Yeah, the projections are really good. The CDC has a website, and it's given here down at the bottom, and it's updated every week. And it gives what they're projecting for a particular state, and even at the county level for cases, but at the state for cases and deaths. So this particular graph shows what they are projecting in terms of cases for South Dakota as of January 24th. So it's a little bit behind, and they're only projecting 4 weeks out. These are the weekly number of cases, and you can see we're quite high. But they are projecting that we're going to be dropping significantly statewide. And when you're on this website, you can actually click on this little arrow here and look at previous projections and how they panned out, which is sort of a nice thing to see. This reddish area that they're showing here is actually a 95% confidence interval, which is pretty big, but at least it looks like it's going down, their projections. So this is for the cases, the number of new cases. This particular graph is for the number of new deaths. And as we've talked about a lot of times before, the hospitalizations lag behind the number of new cases, and the deaths lag behind the hospitalizations. So they are projecting that over the next month, there's going to be an increase in the number of deaths each week, and that's because of this peak that we just had. But soon after this, it should be following then the drop that we're seeing. So hopefully that will be dropping soon. If you look at cumulative deaths, you can see we're still increasing quite significantly. And this is pretty consistent with what the data are showing, and we'll talk about that in a second. If you look at the Brookings County data, the only thing they present by county are number of new cases, because the deaths are so low in number that, because our population isn't very big, that they don't feel comfortable actually making these estimates. But you can see that they are predicting that the number of cases in Brookings County will be decreasing over the next month. So I ran across this graphic that I think is a really good illustration of what a lot of people are misinterpreting. A lot of people are out there looking at unvaccinated and vaccinated numbers within hospitalized patients. Excuse me. And what they might see is that there's a higher number of people that are vaccinated than unvaccinated. There's an explanation for this, and in epidemiology, we call this a base rate fallacy. The ratios that are on this graphic are just made up just to illustrate this particular point. But if you look at hospitalized patients, you can see within this black circle that there are more of them that are vaccinated than unvaccinated. And we've talked about this in a previous video, how you can't just look at the numbers that are hospitalized. You have to look at what's happening in the whole population. And that's what it's showing over here on the right. If you have a high percent of your population that's vaccinated, this number that's within that black circle is a much smaller percent of this population than over here. Here you've got 50% of the unvaccinated people being hospitalized. Well, here only 10% of the vaccinated population is hospitalized. But if you're looking just at the numbers within this black circle, like you are over here, it may look like a higher number of people hospitalized or vaccinated, and it's true that that is so, but you have to look at the total population. So you need to be thinking this way rather than just focusing in on this. And again, these numbers, like in South Dakota, this vaccinated population percentage is smaller than what this is showing, but you still need to look at it relative to the total population that's vaccinated. So hopefully that kind of helps. I just thought this was a nice graphic for showing that particular issue. And yes, there is another variant out there, and it's now, it is still Omicron. It's very similar to Omicron, but it has some additional mutations. And are now calling it the BA2 variant. That original Omicron is now being called the Omicron BA1 variant. And there's early reports out from Denmark that indicate that this new variant is about 1.5 times more contagious than the original Omicron, which is really contagious. I mean, it is a very infectious virus. But the good news is that currently there's no evidence at all that this BA2 causes more severe disease than the BA1. And it also is, there's no evidence that it can evade vaccine protection. So the vaccines appear to be as efficacious against the BA2 as they were against the BA1, which was a little bit lower than Delta, but still pretty good. And you really do need that booster. We have a low percent of the population that has received those boosters, but the boosters will protect better against Omicron, both the BA1 and the BA2, than just having the series completed. Now, scientists are actively monitoring the data because this is a new variant and we don't know these things for sure, but we should know more about it within the next couple of weeks. Right now, it's a very small percent of the cases that are being seen in the United States. And, that will be monitored by the CDC closely. And it's also important to remember that the variants, they're going to continue to evolve. We're going to continue having variants as long as there's a lot of cases out there. And the way to reduce those cases is through vaccination. So just throwing that out. As far as the weekly summary, Brookings, we did have a good drop in the number of cases. And this is also seen for the state. We went from 464 cases last week down to 201 this previous week. Most of those cases this past week were in that 20 to 39 year age group, which is the lowest rate of vaccination. One of the things that we don't know is that these tests no longer include the home test kits. And though the number of those that are being distributed has really gone up in the last week or two. But one thing that's a little bit reassuring is that Victor Huber, he's been on your videos before. He's a virologist down at USD. They've been monitoring the COVID virus in sewage as a way of looking at what's happening in the community. And they have also seen a drop in the amount of virus in the sewage that's coming out of Vermilion, which indicates that in fact this decrease might be real and it isn't attributed just to the home test results. So that's a positive sign. And if you look at the other indicator of level of spread, the test positivity, we are still quite high, but we have dropped. We really need to be down in this level, but we're at least heading in the right direction. If you look at hospitalizations in Brookings, you can see that this last month has been quite high, you know, comparable back to last November or November of 2020. We also had 2 deaths in Brookings. We haven't had deaths for a while, and we did have 2 this past week. If you look, this is the state data, pretty much following the Brookings data. Again, that 20 to 39 year age group's the highest number of cases. And the test positivity for the state looks a lot like what it does for Brookings. You know, it's dropping, but it's still very high. And I wanted to throw in the school data. This is throughout the state, these numbers, these are K-12 students. You can see a couple weeks ago this very large increase, and it is looking like it's flattening out a little bit. The K-12 staff down here and in yellow, these are institutions of higher education. Also, the students showing a pretty big increase. If you look at hospital admissions statewide, we're still seeing increases in this. And again, that's probably due to that lag period. But this is going to be a very good indicator to be tracking now that the home test kits are sort of interfering with what we see in terms of cases. The problem with using this as sort of your main indicator of surveillance is it's really delayed. You know, we don't see the hospitalizations until a couple weeks after there's a peak in cases. So it's really telling us what happened a couple weeks ago, not what's happening currently. So that's the downside of it. But the positive side is that we have home test kits that will hopefully prevent the spread by people identifying. If you look at the hospitalizations, we did see a large percent in that 20 to 39 year age group and a significant number of hospitalizations in these younger ages, although the majority are still in the 60 plus. This is more of what's the immediate, like, current situation in the hospitals. This is the hospital census. And yesterday, the dashboard was reporting 355 people still hospitalized. And that's here. You can see that it's quite high relative to what's happened over time. This was that big peak again in November of 2020. And it is dropping just a little bit. The number that were in the ICU is staying pretty flat. If you look at deaths, we are still quite high. This line, this horizontal line here, is the average number of deaths that we see in a year from influenza. So we exceeded that just in deaths from COVID in the past week. There were 2 deaths, well, actually 6 deaths in young individuals. I can say that this is a young group. And one of those was under the age of 20. That we've had 3 deaths in that age group now, and there was a 20 to 39 year old. So, but we did have a slight drop, but it's still quite high. And I just wanted, all of these slides are in what you post, you know, each week. But I wanted to point out that I've added these 2 different columns here. I do request specifically the age distribution of vaccinations data from the Department of Health, and they provide this to me each week. And it's nice because we can see that Brookings is doing well in all the age groups except this 18 to 24 year group, where we have a significantly lower percent of that population that's been vaccinated compared to the state. But now they are posting on the dashboard the numbers that have completed the series. These data relate to just having received 1 vaccine. Okay, this is one vaccine of Janssen or 2 vaccines of Moderna or Pfizer. So 52% of Brookings County population has received the complete vaccine series. You know, this is quite low. We really want that to come up. If you look at the boosted, only 23% of the people have received a booster. And again, this is quite low, especially with Omicron, which it's been shown that this is really necessary for protection against that particular variant. If you look at the United States, we've had a decline in the number of cases, just like in the state. The deaths here continue to increase, quite high levels, 19,000 deaths per week, which I really don't think people can even comprehend anymore. You know, if you think of 9/11, that was 3,000, and what, you know, people thought of about that, but, you know, here we're at 19,000 per week. So it's just beyond, I think we've just become numb to these numbers. If you look at the world, you know, this COVID has the highest number to date, but it did drop just a small amount in the last week, and the deaths are also increasing worldwide. So, and healthcare workers, you know, in South Dakota, in Brookings, they're really overwhelmed, and now's a good time to thank them. Any healthcare workers that you know, and one good way of thanking them is by staying healthy and not overwhelming them more. And one way you can do that is to get vaccinated. So, and I think you still have your thanks a latte.
This is probably going to show up because my screen is switched, but Brookings is running a campaign through the 11th. If you would like to say thank you to a healthcare worker, there is a website, citybrookings.sd.gov. Thanks a latte. You can go find all the locations in the community that are participating in this, or stop by the city and county government center and fill out some of these for healthcare workers, or you can go to citybrookings.sd.gov, say thanks, and fill out a card online, and we will print it for you, and we will provide them not only with a card, but also a sachet of coffee so they can have a little bit of a perk. But like you did mention, healthcare workers, you know, they have been through a lot, especially, you know, the last month with this spike. You know, it's just a really good time to say thank you to them, and this just gives you an opportunity to do that. So I encourage residents to fill those cards out if you have the opportunity to.
And I've heard from some people that they really appreciate it. So I think it's a nice thing to be doing.
Yeah, I think that anything we can do to say thanks is probably still not enough. So even just something small.
And to actually say thanks if you see someone you know.
Yeah. Yeah, and if somebody wants to print out one of these cards themselves too, I do have a digital file online where people can print these out and just actually give the card directly to someone that they know that works in healthcare work. So if somebody wants to do a personal one to give to somebody specifically, that opportunity is definitely available. But there's something really great about hearing that from somebody else's voice as well. Thanks can go a long way. Also, I do want to mention that at the City and County Government Center, not at the city offices, but at the county office, they have COVID test kits available. They have some, I'm not sure how many they have left, but if people do want to come get a home health COVID test, they are available at the city and county building. Also, the government has put out a website online where people can order, I believe it's up to 4 tests that you just fill out a form and they will send it in the mail. I will put the link to that in the description of this video. It's really simple. You just put in your information, hit send, and they mail them to you for free. So there are some opportunities to get some free home test kits delivered or to your home, or you can come pick one up. And if that can keep people out of, you know, the health system too right now, since they are so overwhelmed, that can help them a lot right now too. If you're not extremely ill, but you want to know if you have COVID, that home test kit does work too.
Yeah, it's great.
Well, thank